Hello, everyone. I'm the president of Swarna Bharat Party, and Mr. Sabhlok is one of the prime founders of this party. And today, now he acts as a mentor. And today, when he is in India, we thought we would take this opportunity to discuss a little about this pandemic policy. Sanjeev, can we start with this the lack of risk-based response that we have seen, that every single life is to be saved, as if all of us would be living till the end of time. I mean, this concept about zero risk is absolutely artificial, and it's not true. It cannot happen. We may die anytime. People die. I mean, in India, every year 1 crore people die. That's about 27,000 people. So how did we come about, from such a robust thing that every year lakhs of people die? I mean, children die, and then we are now talking of not a single death, and taking a bulldozer approach to solve this issue.
Yeah, Pankaj, you're absolutely right. The response of the Modi government over the last 1.5 years has been the most devastating to India since its independence. I think Indira Gandhi caused us enormous harm in 1975 with the emergency, but even that was nothing compared to the colossal destruction of the economy and the lives of millions of people and the plans of 1.5 billion people by Mr. Modi. So what has happened is that right through in terms of all pandemics, our policies have always been, and I was obviously in the IS, I managed a lot of these crises and calamities across the last many years when I was here. There was always an approach that everything should be proportionate and risk-based. And so the idea was that in this particular case, the virus is largely affecting the elderly people. So in India, there are very few relatively elderly people. We knew from the very beginning that the proportional effect on India will be much less than that in other countries, because the average age of a person dying from this pandemic, from this virus, is around 80, 82, or even 85 years old. That's the median age. And so when you look at the pattern, we don't even have people in India above the age of 65. On the average longevity here is around, life expectancy is around 65 or 66. So when we look at the harm across the world, it was known in February itself that it's the elderly and the younger people really have very little to fear from this. In fact, the data that has come in over the last year is very even further conclusive that people below the age of 65 have had fewer deaths per million in Sweden, which did not do any lockdowns, than they have in the normal years. So the risk to people below the age of 65 is actually lower than in the average pandemic. What's happened is the panic, what I call the great hysteria in my book, The Great Hysteria and the Broken State, or Paul Fritchard's and Gigi Foster's book, which has come out, which says the Great COVID Panic. This is actually panic, fear, excitement, panic, etc. And so Mr. Modi, being the panicky man that he is, completely, always panicky and always excited, always emotional, does not have any slightest tinge of rationality in his mind. He went into panic. Okay, and I'll come to why he went into panic. He's so silly that he gets into panic for everything. And so he went into panic and he created the panic across the whole country. Now, this was similar things have happened in the past. The WHO in 2011 published a bulletin which talked about the pandemics of fear. During the avian flu and the swine flu, the same thing had happened. Panic took place across the world. And the panic, the world WHO said we should be afraid of these panics of fear, pandemics of fear, because they are driven by these so-called experts who are basically using this as a platform to gain personal power and more money. The more the attention they get from the media, the more the money that is thrown to them, and the greater the power they get. So this is actually a clear-cut case. The WHO had itself said that be very afraid of the experts. Be very, very afraid. This is 2011. Yeah. Okay. And this is what happened in India, that our experts so-called went and started doing some crazy modeling. They're very good at making stupid models. They did that. Of course, Modi was completely in panic. I had contacted Rajiv Gauba, my batchmate in the IS, who was the at that stage a cabinet secretary, and I think he might have just retired. These fellows simply went into panic. And that is, I think, the reason why we had this horrendous response in India, which we will talk about today. Yeah.
So when you say that the researchers get money, it's more in the form of they being doing their kind of research. So they get money, and this thing is a big field of study. The ethical issues of such researchers, they want to become more prominent, so they would be funded more.
Yes.
So this was what you were hinting at when you said that.
This is what WHO clearly said. In fact, they also cited the pharmaceutical companies, pharmaceutical industry, and the media. Both, all of them combined, they actually get greater amount of funding through these particular pandemics and so-called panics that they are created. And so we had this vast vested interest that was going to attack us, attack the common man through exaggeration and fear mongering. That is what the role of the government, and Mr. Modi cannot see through that. He is completely incompetent, and so he's still in panic mode. Every day I go on the television in India, the panic is continuing because of the complete inability to think by the BJP government. The India's position is so bad that we will talk about it shortly. But they could not see through the whole vested interest and the massive paraphernalia of industry and media who are benefiting from this panic.
Yeah. Now I would imagine, there are lots of things that the West does. For example, their universities, the best of the universities are actually private universities. For example, like Harvard. But we do not follow that. But when panic set in, we followed the Western nations. I mean, it is such a sad and tragic thing that every year 2 lakh children in India die of pneumonia, a respiratory disease, and 2 lakh children die of diarrhea. So children die. Children die of lots of other diseases also. My brother died when he was 3 years old of leukemia, blood cancer. And so yet the media does not pick up, did never pick up those kind of stories where a preventable disease, pneumonia and diarrhea, these are preventable diseases. But when COVID struck, everybody went crazy. I think this is so sad that there is a sort of class division, that the rich, when they found out, the middle class, when they found out that our children will die, they said, shut down everything. But the poor, 2 lakh children, and 2 lakh pneumonia, 2 lakh diarrhea, and many host of others, but nothing changes then.
Yeah, so essentially, this has also been a very good point you picked up there. This pandemic's response has meant that after the pandemic, the poor have become much poorer across the world, apart from the fact that many millions of them have potentially died and will die because of shortening of life caused by all this poverty. And the rich have become extraordinarily richer, and people working from home and the software company people and all that stuff. So we have seen a massive attack on the poor by Mr. Modi. India's poor have been devastated by this attack by Mr. Modi, who has not understood the self-interest and the vested interest of these people. What he should have done, Pankaj, was to follow the age-based risk management about which I wrote on the 6th of March in 2020 in the Times of India on my blog. It was a very straightforward thing, like any other thing. You look at who's actually getting the problem, who's getting the disease, and what can be, and what's the magnitude of it, and what can you do? And so the answer was very simple, which was to start isolating the elderly. The higher the age, the greater the level of isolation. So for my parents in India, I basically asked them to not mingle with the rest of society until this pandemic phase has gone. Now, that was a problem, but I think they have also suffered mentally from that period. But I think that was the right answer, and it was manageable. And particularly, I would say, for the upper middle class of India who have the capacity to do that. And by the way, the elderly, my father's 89, mother's 88, these people are largely found in the upper middle class families, because the lower middle class and the poor do not even have anybody in that age group. There's virtually everybody dies before they reach 80. So if the elderly were found in the upper middle class families of India, and the upper middle class families had the capacity to isolate them slightly and say, please stay away. We'll not come close to you. We'll provide you the food and other things, and we'll get the things for you. But let's try to minimize the risk to you. The rest of the world should have gone on doing what they're doing. And as we know, the lockdowns, which Modi said on the day he announced, this man is so mad. People should hold him to account. And that's why this party should hold him to account. He said the lockdowns will be there for 21 days. That's what he said. And I think this party should hold him to account. What is this nonsense of 21 days? It has gone on for 1.5 years. And it did not stop it. It did not stop the pandemic.
He declared with just 4 hours, notice, that he declared at 8 p.m. and from 12 midnight, there was lockdown. And then we saw the kind of tragedy, the kind of heartbreaking images that we saw. Young children dying after walking kilometers, thousands of kilometers, hundreds of kilometers. This was mismanagement at a colossal level.
It was an attack on India by Modi and BJP that I think Indians will not forgive once they understand how badly he has harmed them. And this party, Swarna Bharat Party, should talk to the poor of India and show them how much harm has been caused by Modi. Because if this political action is not taken against BJP and Modi, they are not only the socialist party that are damaging India, but now they have damaged the poor in a level that is unprecedented. So you're right. They should have done the age-based risk management, but they went into the worst possible option, which is to harm the people who are not at risk. They harmed the workers who are actually young people. They harmed the children, as you said, who died in the process. And so this is where these fellows should be held to account. I believe, that this is basically a crime against humanity, in my view. And one fine day, hopefully, people will recognize that as the crime against humanity by Mr. Modi.
Yeah. So the world has, totally moved away from the evidence-based approach. I mean, in medicine, evidence-based approach, I mean, if a medicine doesn't work, you change it. If an approach doesn't work, you change it. So it was so crazy. It was absolutely crazy that this approach has been followed, and the interest of the vulnerable has been destroyed. The young people who would have to develop their talents, their capacities, their skills, and the poor. I mean, when there's, let's say, rickshawalas, auto rickshaw drivers, fishmongers, those vegetable vendors, they are the ones whose lives where I actually have met many such people. I have met the union leaders of the Auto Rickshaw Association and people like them. And I have seen, say, small restaurant owners. After the first lockdown, they had been reduced. One person whom I know, he owns a small restaurant. He had to sell vegetable on the footpath. That is what has happened. So it is. I just hope that the people remember this nonsense. I'm struggling to find the right word. This attack on the poor people, and they number in crores, more than the total population of the US. I just hope the people remember, and we are able to, channelize that anger into something right, something worthwhile.
Yeah. So I think the other point that Modi has betrayed India is basically he has copied China. He knows that China is the greatest enemy of India. We have very clear-cut proof of that for the last many years, and particularly since Xi Jinping has come on the scene and attacking India's borders, right? So it is very clear that the greatest enemy India has is not Pakistan, but China. And China is the one that caused all those fake videos and promoted the false lockdowns that have never been done in human history. Now, this is the whole point. Never in human history were these things ever done. There is not a single book. I challenge anybody in the world to show me a single book or a single chapter or a single published paper that recommends lockdowns for a respiratory virus pandemic, okay? In fact, all the papers that exist are actually of the opposite side. So when the Xi Jinping did these lockdowns, it was Modi's job. It was Rajiv Gauba's job. My batchmate who was in the IS cabinet secretary, it was his job to look into these issues, and the RAW had to look into this matter, RAW, to see what is sitting behind the panic. And the panic was caused by China. And so we have the situation where China has attacked India. in disguise, and Modi has accepted this panic from China. And he has gone mad himself, and Rajiv Gauba and the IS community has gone mad, and nobody stopped it. What was the point of having all these bright people in the IS who could not even think through this thing? So I think the point I'm making here is that we need a political party in India that will go and tell the poor people about these harms. I'll tell you another thing. This is actually not all the Western countries did this. Sweden did not do this. Sweden followed the standard policies. In fact, Anders Tegnell said, what are we doing? Have we forgotten what we learned for the last 100 years? He was saying it repeatedly. What are we doing? In many countries in the West, they did the same thing. They fell for China's trap. And I've given a lot of details on this China's trap separately in my writings. I won't go into details here. But the general point is that Modi has fallen into China's trap. And we know from sure that these lockdowns are so devastating that in a country like New Zealand, the cost-benefit analysis says that the harm to New Zealand from the lockdowns is 50 times more than the benefit. Imagine in a developed country that has happened where they actually gave people money to sit at home. Like this person you said, he had to sell his shop and start selling vegetables. But in New Zealand, they actually gave money to people to sit at home. Even then, the harm was 50 times that of the benefit. In India, I would imagine the harms are about 1 million times greater than the benefit. There is no benefit. In fact,
it was life and death. It was in many instances, it was life and death.
Absolute life and there is no benefit because you can see clearly India, the pandemic could not stop. The lockdowns did nothing to stop the pandemic. It went right through the country in 2 waves. First wave last year, another one this year. By now, 65-70% had already got the immunity, the antibodies, and that's how the pandemics normally go. They actually spread wild, regardless of the so-called lockdown. So lockdowns did not prevent a single death in India. Lockdowns did not prevent, and that another thing to mention is New Zealand is not the only cost benefit. There are tens and tens of other cost benefit analysis across the world about this issue. And all of them say clearly only one thing, that lockdowns have been devastating to every single country where they've been tried. So we need to talk about the children who have suffered. So tell me, Pankaj, you are the principal of a school and you are the principal of the president of this private school association in Assam. Tell me about what you are understood about the harms to the children of Assam.
Yeah, I'm actually the director now. I resigned as the principal in 2012.
Director, yes.
Yeah. So, and of course, the president, as you said, of Private Schools Association. And it has been immense. I mean, so bad that it's difficult to, where to begin. First of all, we must talk about the harm to children's education. That is the first and foremost. And there have been some anecdotal evidence, but another association, that's an affiliation of associations. It is called National Independent Schools Alliance, NISA. It has started a study on learning level gap which has occurred. They are doing it across India, and in Assam we will start it. So now we have to start only online. There is no other way, because students up to class 8 are not coming, class 9 are not coming to school. And funnily enough, class 10 and 12 are coming, and they've recently been allowed to come 10 and 12, but not 11. So, logic, I have to struggle to find what is the logic. It's very difficult to even understand. 10 and 12 are coming, but not 11. Okay, anyway. And the lower, the class 1 to 5, class 5, class 6, 7, 8, these students have even lesser of a much less risk than even the college going students. But anyway, we have said it quite enough. So we'll go to the harm. Now, up to class 2, 3, 4, definitely up to class 2 or 3, students read, they learn how to read. They are not reading to learn. For example, I want to know about, let's say, what is going on in Rwanda. I read about Rwanda. I go through the newspapers of Rwanda, research articles, and I learn about Rwanda. But children, they learn how to simply read. So a student of, let's say, class upper KG or class 1, that student is still learning how to read properly. And how much benefit will happen in online classes when you are trying to learn how to read. That is why Sweden said that up to 16-year-old, that is our corresponding class 10, they never shut down for a single day, because if they stay at home, then emergency workers, they will also have to stay at home. So somebody has to take care of the children. That is why they did that, and they were successful. Not a single healthy child, those who did not have any serious pre-existing conditions, like say somebody is suffering from cancer, a child, then of course that would be different. But any healthy child, not a single thing happened, single fatality or serious case happened in Sweden. But here, learning level has gone down very badly. There have been learning gaps. Today, from a few days back, the class 10 was allowed to come. So the first thing that we do, we are doing it now, even now, we have taken a diagnostic test now to begin with, because we have to identify where the learning gaps have occurred. Now you'll know that across India, these are the two subjects where they have got maximum problems, that is English and mathematics. The learning level of English and mathematics is absolutely poor. You have ASAR, the test done by Pratham, and NAS, National Achievement Survey done by NCERT. Both of these show that class 8 students cannot do a simple sum of class 5. Class 5 students cannot do a simple sum, two-digit addition. 70% of the students, 70-75% of the students cannot do two-digit addition while studying in class 5. So this is already a bad situation. And the private schools, whatever that may be, they are already somewhat in the elite category, you can say. So a student who is paying a fees of, let's say, parent 50,000 per annum, they are already in the elite class. But even there, the learning gap has been horrible. So what we are doing is that the teachers, they come to school and online works are given, and parents come to school and deposit their works. So from the copies that we are checking, we find that the learning level has fallen than, let's say, in 2019. So whatever was the learning level in 2019, I would say it is this. But how much less, we do not even have that data. But from anecdotal evidence, let's say one man, he used to coach part-time as a cricket coach, Devobrata. He used to coach our students long back. Now he has become a father. His daughter has been put here. 2 years have gone by. She has not even seen the school. So he was asking me what to do. I mean, he is at his wit's end. This girl, she is very quiet and she is unable to read properly. I mean, and that is natural. So there have been many such cases, dozens of cases where parents have called us up asking for our advice, what they would be doing. And we are at our wit's end ourselves. I mean, we don't know what we will be doing. So this is the learning gap that has happened. Next thing is the jobs. For example, buses, the school bus. Many of our school buses, let's say 3 of our school buses are still bank loan. We have to pay about 60,000 rupees per month as EMIs, the money that we have to return to the bank. And there is no fees, zero fees. No fees has been collected during this closure period. So where from this money will come? So after paying the employees, many of them we were compelled, after 1 year of paying some of the salary, not the whole, during the lockdown period, after 1 year, we had to stop. So these people have, now they have gone for what? Some are doing working as daily wage earners. So their income has reduced drastically. So that is one thing. So this way, the whole thing has become a vicious cycle. So everywhere, teachers, they are completely, their training have stopped, their professional growth have stopped. So any new vacancy coming in, we would be stopping that because we have to, our fees was lessened, say 25% every month of classes not held, and in April 50% was reduced by the government. This year also one person did a PIL in the court, so Supreme Court has already addressed. So the schools have to pass on the benefits. So we are in the process of finding out how much money has been less because in-person classes have not happened. So schools will also have to return some part of the fees or take less amount. So schools income has gone down. And for example, in Guwahati alone, I know of a person, a small school owner, so-called low-cost school or budget school. That man is now plying an auto rickshaw. His income has dried up completely because These were low fee school means their parents have been impacted more. Let's say some 60-70% of our parents are government personnel, government service personnel. So they are getting their salary. So our parents are not as impacted as a low cost, low fee schools parents. So there, I would imagine 100% of the parents have been impacted. So their fees have gone down probably by 70-80%. So that man is now plying an auto rickshaw. So this is at every level, whether it is students learning level, which is the most important thing, teachers as professional growth, another important thing, and the financial condition of the employee, especially the support staff, the cleaners. Let's say we had a few part-time staff to clean the toilets. Now we release them. I mean, where did the school get the money to pay these part-time staff? So they have been released. So the support services, teachers are getting their salary, at least in most schools they are getting 100%. A few, maybe 1 month, 2 months is still left to be paid, but teachers are mostly paid. But support staff's financial condition is horrible. So I would say these are the three things where school has been impacted very badly.
Yeah. Thanks for that. It's a very good description. I think the thing that seems to be most problematic out of this is the comment you made about the low-cost private schools. Now, people across the world don't really know, but in India, about 1/3 of the children are going to low-cost private schools, which are charging not more than, say, $2 or $3 a month, 100, 200 rupees a month kind of fee, which is nothing, peanuts. But that is enough to run these small schools in very dilapidated conditions. And I've been to them all over the country, and they provide better quality education than any nearby government school. That's why their parents, who are the poor people, they send their children to these schools because they value education. So what's happening, I'm hearing from you, Pankaj, is this is where I think we need to do some more research, is the devastation caused to the poorest of the poor children. Because, the middle class parents whose children are going to your school, somehow, their parents might have some time to teach something. So their loss of education will be maybe 60% or 70%. But for the poor who are now gone so bad, the children, that they have not received any education for 2 years, and the parents are no longer able to afford it. For these children, I think education is now finished. Like India has almost very, very low levels of literacy in the past. So these children probably will not get back into the school system forever. And that's a complete devastation of an entire generation right in front of our eyes in India. So we have so much proofs of this harms of lockdowns. I think the calculations, I'm working on a project to work out the actual costs and the benefits of lockdowns in Australia. I don't have the time to start a similar project here, but I think maybe India Policy Institute or somebody can, commission something if possible. But the idea is that we should do a proper cost benefit test of these harms. And I think Mr. Modi should have done these things. He should have understood these things. He should talk about these things. My IS batchmates and colleagues and others, they should have studied these matters. We are supposed to look after the welfare of the people, but in this case, we have not. And the other one I want to mention was the continuous harm being done by the mandatory mask policy in India. And some kind of a court has dictated that policy, I understand. And when Supreme Court in India in March had clearly said that masks are harmful, by the way, this is clearly part of the Supreme Court's own guidelines. Now, at this stage, India has been made mandatory masks, even inside a car if you're driving alone. And the police are busy out there attacking people who are, and harassing them for fines, 2,000 rupee fines, which are quite serious fines for Indians. So we are seeing the continuous devastation of India by Modi. He has, I think, destroyed the GDP, but GDP is not even beginning to see. The reason why GDP doesn't matter in such a thing, Pankaj, is that the people at the bottom of the pyramid, which is probably around 60% of the Indian population, they actually are earning not more than 5 to 6% of India's GDP in the first place. So when you're wiping out the GDP by 7-8%, which is what happened in India, the proportionate wipeout of these poor that you mentioned is that almost 80% of them have lost their incomes. So the GDP of India is very highly skewed. Most of the money, most of the earnings are in the pockets of the rich or the middle class. So the rich have probably, maybe 20-30% of GDP is owned by them. The next is the middle class, and the people at the bottom, the 80%. I had done this calculations that you can eliminate India's poverty by just 2% of India's GDP. You can eliminate India's poverty completely if the government spends 2% in direct transfers, 2%. So when you devastate GDP at 7% or 8% in India's case, and you look at the distribution of that, Pankaj, you will find that it is actually the poorest of the poor whose incomes have been wiped out. And so these poor are now back to where they were 30, 40 years ago before the reforms of Narasimha Rao. And I think the job of our party is to tell the people,
all those who have somehow gone above the poverty line are now back into it.
Yes.
So their ability to get themselves treated, send their children to school, buy themselves some decent meal, or maybe somewhat resembling to a proper house, everything has been eroded. People do not understand this, that for good health, you need to spend money. But why doctors should be saying that, but they understand that to get the services of an echocardiogram or an MRI or a PET scan, then you need money. But they do not understand. They say, to hell with economy. In the case of, they said, no, COVID is such a serious thing, to hell with economy. But they are the ones who would say, yes, pay us 5,000 rupees for a PET scan.
Yes.
So it's so stupid, so ignorant, and so full of ego that even now, the lives of people are destroyed by bad policies. Now, this is the saddest thing, that just changing these stupid policies, we can make people's lives can be better. For example, recently the Theater Owners Association, those who own the movie, cinema halls, they did a protest, and the Chief Minister of Assam said that, please do not pressurize me, because this is not a political issue, this is a medical issue. Oh, really? This is a medical issue? I mean, what medical problem is happening to the people? When even at the peak, till now, less than 450,000 people have died in 18 months. This is cumulative numbers. From March 25 till that 25th September, it is about what? 18 months we have completed, or I think so, 18 months, yeah. So during this 18 months, 4.5 lakh people have died, less than that. In Assam, some 5,000-6,000 people have died. And if we talk about the numbers, that means within these days, it is somewhat like 800-900 people who have died every day. So 27,000 people die. This figure is less than the total 4.5 lakh people, is less than the total number of people who die of infectious diseases, whether it is TB, malaria, diarrhea, pneumonia. You take the numbers, and COVID is much less. Yet we are saying, now what are these moviegoers supposed to do? They are supposed to starve. They are supposed to kill themselves. What are they supposed to do? If the government says you cannot open it, then reimburse them, give them money. Otherwise, how will they live? Not a single government employee's salary has been deducted. How are these cinema theater owners, how are they going to support themselves? How are they going to treat their children when they get sick? So this is actually a political decision. This is nothing but power grab by the politicians. So politicians will never give up power that they have got. No politician, no government, no authority gives up power. I mean, this was said by who? One Mises, I think. First, probably he is the one who said it, that once a bureau is established, an agency is established for extraordinary time, the people who come in to join, they will find new reasons for their continued existence. So these policy measures, which have restricted everything and done nothing, even medically, it has been proved to be of zero, actually negative, because it has destroyed our mental health and it has lowered our immunity. So lockdowns are not only an affront on the economy, on our liberty, but also on our health. Medically, it has been an affront. But if the people do not realize this thing, now they will have to ask questions. How come we went to a place where we it has become, medical policy has become like, public health policy has become like religion. And unless we wake up to this fact, these policies will not be let go of by the government or the government agencies or by the contractors and companies that are profiting from the management of this policy.
Absolutely spot on there, Pankaj. I think this has been a fantastic discussion. Let's, we'll have more of these discussions in the coming days on different topics while I'm here in India. I have some more time. And let's see whether the people are willing to understand the value add that Swarna Bharat Party can provide as India's only liberal party, the one that stands for liberty and reason, unlike BJP, which has basically devastated India ever since it came to power. And in fact, the Congress had devastated it before that. So I can tell you that Congress is the most corrupt organization ever in the human history. I very close, I worked with a lot of Congress people, including Chief Minister Hiteshwar Saikia of Assam, who was the most corrupt person you can imagine. So India has really no hope if it continues with these political parties. So you've raised very good points there, Pankaj. And I hope that this particular message reaches out and people start paying attention to the work that you are doing along with many other people on the ground in Swarna Bharat Party.
Yeah, thank you so much, Sanjeev. Thank you, and I thank all the viewers who have watched this discussion. Thank you so much. Bye.